And then for our listeners out there, we need a little bit of a definition. So we need to define in functional medicine, integrative medicine, genomics.
Sure.
Can you give us a little
Oh,
dictionary thing there?
sure, of course. Integrative medicine is, if you really think about the word, it's just integrating. It's integrating all the modalities of medicine. So what's interesting and the difference between integrative and functional is integrative is a little bit wider net of using things like chiropractic, traditional Chinese medicine, functional medicine, homeopathy, even like clinical hypnotherapy, like and conventional medicine. It's integrating all forms of healing and modalities to really address health concerns. That's literally what integrative medicine is, integrating all of the modalities. Functional medicine is much more of a root cause biological kind of focus on disease. And I actually am a big supporter and believer in functional medicine in the sense that I think if we're looking broadly at disease states, we do need to see both a global, more of a macrocosm of disease as well as the microcosm, and for us to really understand where it's coming from and how the cells and the biochemical pathways are occurring for something to occur, it's important for us. And now that there's more and more studies about it, it really does allow us to put it all together and start at more of a cellular level. Now, what's interesting is that if you combine things like functional medicine and then genomic medicine. So genomics is looking at our blueprint, our DNA of what makes us us, and also what disease states are based on the inherency of our DNA, what we're predisposed to. So if you look at the spectrum of our health, if we're able to, which is what human longevity does, start from the beginning of someone's blueprint and then look at their predispositions, then start to look at the cellular level of what needs to be optimized, then look at the imaging level and the biomarker level of where they're at right now, and then put that all together, more of a circular loop of saying, okay, here's our genomics, what are your predispositions, how can we fix that, what are we finding right now, and then we take the data and recheck it over and over, and that's ultimately what leads us to a data-driven circular pattern of constantly feeding back into the info so that we can continue to move someone's health forward to optimize it. That's ultimately what we're looking for, right? So integrative medicine then at the other end of it is, again, this integration of genomics, functional medicine, diet, lifestyle, exercise, risk factors that are identified now versus future risk factors. A lot of what we do, for example, we can even identify dementia risks far in advance and then also track the organ changes over time and as well as the functional changes over time, because as you know, you might see shrinkage of the brain, but you also sometimes maybe it's so early on that you don't see any volume change in the brain, but their functionality is changing. So there's so many factors that you do have to integrate together, both to identify their issues, but also to integrate together so that you can have a comprehensive whole systems approach to health. So whether it's, you know, dementia risk, both on the diet end, exercise end, the stress level end, because that will impact your sleep and exercise and all of that. So it's integrating solutions, but also integrating the diagnostic status to figure out where your health is right now.
Right. And one of the things that, because you're talking about a whole system, it's not just there's so many, books out there and different podcasts, and it's not just about just doing genetics or just doing one
Correct.
thing. It's about taking, like you're saying, that integrated approach to
Correct.
health and figuring
Right.
that out.